I was living in Vancouver on the downtown east side for multiple years prior to coming to VGH, and I was sleeping at Directions Youth Services. They have a MAP program across the street from St. Paul's on Burrard, and that was the place where I would sleep occasionally. Majority of the time I was sleeping on the street, but my only option for a bed, which wasn't even a bed, would have been Directions.
And at this point you're using?
Every day, down inside.
Down inside, so down being fentanyl?
Yes.
And side being methamphetamine?
Methamphetamine, yes. Yes.
Okay, so...
Intravenously as
Intravenous,
well.
so you're injecting?
Yes,
okay.
yes.
Now walk me through what a day would be like.
It would be a matter of finding a spot where I felt safe. Initially, when I first came and was living homeless on the downtown east side, I had more personal belongings than the average homeless person would down there. And I remember the first night I spent there, 24 hours, I nodded off for a period of time. I woke up and there was an incision in my pants where my phone was. And someone had cut an incision in my pants to access my phone, to pull it out of my pocket while I was sleeping. So from that day forward, I experienced it again and again and again. So before I would even sit down, never mind considering sleep, never mind considering getting some rest, before I'd even sit down, I would have to contemplate, is this somewhere where I know homeless people like myself are gonna be around me? Because you can't trust each other. Chances are the people that could have been stealing my stuff were people I associate with, were people I would, in that lifestyle, consider my friends, right?
So sleeping on, wherever you can, and using methamphetamine and fentanyl.
And fentanyl intravenously.
Intravenously.
Yeah. So I would multiple times a day have to access safe injection sites to retrieve needles and the proper supplies to try and stay as clean as I possibly could. And
so how many times a day would you use down?
Anywhere from 4 to 8 times a day I was injecting in my arm.
In your arm. So that's the fentanyl?
Yes.
Okay. And then what about the methamphetamine? How did that fit in?
Approximately the same. Majority of the time I was mixing the two.
Okay.
But yeah, with the amount of time I was injecting on different occasions, it created health problems endlessly. To the point where I remember there was a period of time where I couldn't inject myself because I didn't think I had any access to my veins at one point in time.
You lost your veins?
Yeah.
So you're living on the streets, you're using methamphetamine and fentanyl, you're getting supplies from safe injection sites, you're injecting into your arm or into your veins. How do you support yourself? Like, you have to buy this stuff, right?
Yeah, I would go, everyone downtown has their own kind of way of making money. Some people panhandle, some people, they all have their own thing. For me, I'm embarrassed to even say this today, but my way of making money was breaking into vehicles and stealing belongings and then selling it on the downtown east side, and that created a lot of stress, anxiety, embarrassment. I've been caught in people's vehicles that have families and they've come out and start screaming at me and yelling at me. Like, I'm not the kind of person to be doing that, right? It's the addiction that is forcing me to do that. My addiction got so bad at a certain point because I was using so much. My tolerance was then to build. I couldn't survive off 20, 40, 50 bucks a day. Like, my habit was costing me like hundreds of dollars a day at some point.
So at its peak,
certain times.
At its peak. How many hundreds? How many hundred?
Multiple. Like, there was days where I would buy a ball of fentanyl, and a half ball of methamphetamine.
So a ball being?
A ball is anywhere from $250 to $350, depending on who you're going to. And methamphetamine anywhere from 50 to 150. And the next morning I would be scrambling, scraping out baggies, trying to get one last shot for the morning so I could go figure out ways to make more money that day.
So let's talk about that, because you're talking about this drive to use and the use escalating and going up and doing things that are not in character for you.
Yes.
To support it. Can you describe what that drive to use is like?
It's like nothing I've ever experienced in my life before. Like, love for your family is one thing, but when you have something that controls you not only mentally and emotionally, because whenever you're withdrawing, your temper is going AWOL, you know what I mean? You're just out of your mind, period. I would experience withdrawals to the point where I couldn't move, I couldn't feel like I could function, I couldn't, you know what I mean? There was times where I didn't have any money. I'm experiencing that drive to use. I want to use so bad to relieve this uncomfortable feeling in my stomach.
Describe the withdrawal.
Pains in your knees, it's constant body sweat, but at the same time you're chilled to the bone where you want to throw on like a winter jacket in summer, but you're dripping sweat down your forehead to the point where you can't even see. Sweat's getting in your eyes, you just, like the pain in your back, like, oh man, thinking about it now it's hard to explain, because it's like your body is trying to get out of itself. It's trying to escape this jail cell you're putting your body into by contributing all this negative into your body, and it's trying to.
Right.
Yeah, it's hard to explain,
right,
to be honest.
People, like people who don't have the same perspective that we do, don't fully understand the process of addiction, because they may think that people, they're just partying, they're using to get high and have fun,
and it's their choice.
Yeah, but there's a spectrum, so people use for all different reasons. But
most
for
definitely.
you, at that point, you weren't partying.
No, I was by myself every day. Partying in no, not even close. I was embarrassed of everything and anything to do with me as a person, as a whole, who I was contributing to society, who I was within myself,
right,
spending time alone. The only thing that gave me some sort of peace of mind was using.
Okay.
So when you're stuck in that circle of the withdrawals, the crime, the guilt, the emotions of being embarrassed of what you're doing to contribute it, and it's a cycle that is endless, because your mind thinks the only solution to give yourself some sort of freedom for a short period of time is using.
Right.
And then it comes right back.
Right. You painted a terrifying picture of the drive to use.
Mm-hmm.
And it sounds like at that point, the primary drive was to relieve withdrawal and the negative emotions and memories, etc. Can you describe what it feels like when you get that relief, when you get the high or the intoxication of fentanyl? What is that like?
The best way to describe it is it's comforting. It's like you're at peace. You feel safe. You feel like there's no concern for anything. A giant sense of relief and freedom of negative things that may be affecting you in your life. Because there was periods of time where I was using fentanyl where I wasn't at my peak homeless, intravenously using on the downtown east side.
Yeah.
Where I was still continuing to use fentanyl.
Yeah.
Just in a different way. I've snorted fentanyl, I've smoked fentanyl, living at home with my mom. It could be anything from, you know, there was a period of time where I first started using because of the circle of friends I was surrounding myself with. I was experiencing a lot of drama with my girlfriend. I just got caught being unloyal, and I would use, and it's like I didn't get caught doing anything.
Right. Okay.
I don't even have a girlfriend. I don't have any responsibility. You know what I mean?
You use, then the horrifying circumstance that you've described to me goes away, essentially.
Yeah.
And how
no longer exists.
And how long does that last?
At most, 15 minutes.
Huh.
20 minutes.
Okay.
At the most.
Okay. And then?
Unless you continue using, but no one can sustain a high for endless amounts of time unless they have endless amounts of money, right?
And then what? And then back to the grind.
And then it's a matter of a sense of panic if it's the last you have. If it's not the last I would have, and I just got high and the rush of the high was no longer there, if I had substances still on my person, I would feel a sense of freedom because I knew I had more to solve my issue in the future that I know is coming.
Yeah.
And the freedom that I know my drugs can solve has just left me because my high is now over.
Yeah.
And I would just go and try and accumulate more money, more substances, more.
And this cycle continues.
And the cycle continues.
You were also using methamphetamine.
Yes.
And you had experienced some psychosis at that time as well.
Yeah, I'm at my peak, most definitely.
At the peak. What is that like? What is it like to be psychotic?
It's embarrassing. A lot of the time, I couldn't recall. Like, I would have like blurs of what I was acting like.
Yeah.
Throwing shit in every which direction, throwing your body in positions that are unimaginable, screaming and yelling gibberish that means absolutely nothing. It's not English, it's just your body freaking out, and there's no way possible for you to stop it until it stops itself, and then you can gather yourself together. And for me, speaking for myself only, the only way I could solve that problem without it coming back, if I touch a substance again, is sleep.
Okay.
And sleep's hard to come by. Hard to come by when you're on the downtown east side. It really is.
Tell me what happened, the reason you ended up coming to Vancouver General Hospital.
The reason why I originally came to VGH was an injury I received at a shopping center in the downtown east side. I was pushed down a flight of 53 stairs from a security guard. I was using in a public washroom, ended up falling asleep in the stall where I was using in the washroom. The mall ended up closing. The security guard, there was two of them, the security guards were doing their rounds to clear the mall before they closed the doors and leave for the night. And they found me in the washroom and told me I needed to get out of there. And so I did. Reason why I was there in the first place was because it was pouring rain outside, and I was just trying to get somewhere to get a little bit, get out of the rain, stay dry for a little bit, right? And as they're escorting me out, we were exchanging comments. They were belittling me. They were making fun of me. I was having none of it, so I was returning the comments in return, and I was 3 steps from the top of a series of 3 flights of stairs. And I said something to him that pushed him over the edge, and he shoved me from behind, and I went flying down the remainder of the flights of stairs, ended up landing on the floor, breaking my biggest bone in my body in my left leg, my femur, and screaming in agony. They ended up, one security guard picked me up from my right side, the other picked me up from my left side, and they dragged me out the remainder of the mall. It's pouring rain outside, remember? And they threw me out onto the pavement in the pouring rain, threw my bag beside me, and then locked the door.
Oh.
And so, yeah, it's hard to talk about even still.
Sure.
But yeah, and then I seen a friend of mine, a familiar face, and asked him to help me walk to the 7-Eleven up the road for access to a phone to call the ambulance. And I called the ambulance, and they showed up and were great and took me to VGH for treatment and surgery on my leg. And when I got there, there was obviously some hesitation with me realizing that I've just broke my leg. I have no way of walking out of here. I'm going to be experiencing withdrawals either right now as I'm speaking to the doctor that I'm speaking to, or soon after the fact. And realizing that fact and wanting to leave, realizing that I can't really leave, I just broke my leg. Anger set in, frustration set in. I was being utterly rude to the nurses, to the doctors. Yeah, they were really understanding of my situation, super helpful. Yeah, they called my mom and explained the situation and kind of laid out my reality at this point. My leg is now broken. Thank you. Yeah. And I'm gonna have to undergo surgery if I want this resolved. There's no way of me leaving. Countless talks with the doctor, countless talks with the nurses of them basically begging me to stay because they knew how serious the injury was. They knew how much I needed the help to get better. And that surprised me at first because experiences I've had at other hospitals in the Lower Mainland, in town, in the city, haven't been like that. If I wanted to leave, it was, okay, your bag's packed, we'll go pack it right now, see you later. Like, they want to get rid of you as soon as possible. And it wasn't like that at VGH. I experienced something totally different, and I ended up not taking their professional advice, leaving to go use one more time. Ended up somehow managing to convince my mom to take me out of the hospital. I used one last time. I promised her that if she got me out of there, I would come back and undergo the surgery. So I was a little bit hesitant to come back because I didn't know how well they would receive me coming back, thinking like, you just left, like what are you doing back here, kind of thing, right? And yeah, I ended up doing what I promised. I went and used one last time. Ended up getting a ride back to VGH from my mom. As soon as I got back, my room was still there. My bed was waiting for me. Like it was like I never left. Yeah, as soon as I got back, I connected with yourself.
Yeah, I think well, you connected with our service, the CPAS.
Yes.
Complex Pain and Injection Service.
Yes.
It was complex, right? Because we now have a patient who tremendous amount of trauma. I'm talking about emotional trauma, right? Mm-hmm. Severe addiction to fentanyl and methamphetamine, right? Who has a bad injury, who's just had surgery, and is in a lot of pain, right? It's a complex scenario for multiple reasons. someone who uses that much fentanyl, pain management can be very challenging, right? Because they're so tolerant to opioids, right? In addition to that, there is a worry of withdrawal, and patients often want to leave hospital, just like you described, to use. Just like you described previously, that drive to use is still more profound than your need to stay and take care of that.
Most definitely,
right?
yeah.
Right. So that's what. So our initial goal. Yeah, sorry.
And I just have undergone surgery.
That's right. That's right.
So
that's
now
right.
I have an open wound that needs healing, that needs the care of the hospital and whatnot.
So our goal initially was, okay, let's take care of the pain first. So we started, high dose opioids, intravenous opioids, but also we did what we call multimodal pain management. Okay, so now you're in hospital. We're doing our best, and you have some choices to make, right? And I think one of the key components was also your mom was at your bedside.
Yes.
And you have some choices to make.
Yes.
What was that like?
Are you talking like to go home?
Well, so I think at that point I came on the scene, and at that point I came to your bedside, and we had to have discussions around treatment for addiction.
Right.
Right. And we talked about, let's talk about the opioids first. So was it going to be methadone, Cadian, Suboxone, so opioid agonist therapy?
Right.
And you landed on Suboxone, so buprenorphine.
Yes.
Right.
Which I've had experience with in the past.
Okay.
Successful experiences in the past with it.
Right. Okay.
Which is why I decided going on that route.
Yeah. Okay. And we did that, and we did it again in a very sophisticated way, in the sense that you have reason for pain, you have reason for withdrawal, but you're interested in buprenorphine. So we had you on, I remember, intravenous hydromorphone, and we did this protocol that we created here, which we call rapid microdosing. So we microdosed you in the background while you're on these infusions, got you on buprenorphine. We're still managing your pain.
Right.
At this point, the cravings are starting to go away, I believe.
Most definitely,
right?
yeah.
Right.
Almost immediately.
Right. I kind of saw you at this intersection where...
crossroad, yeah.
At this crossroad. You had come from a horrible circumstance on the downtown east side. You're in hospital. And now you're on opioid agonist therapy. You still have this injury.
No longer withdrawing.
And you have to make some decisions around where you're going to go from here.
Rehabilitation of my leg.
Right.
Where I'm going to live.
Right. But and then, exactly. So how did you choose? I guess the question is, what was different this time? What is the reason? Because you ended up going back home with your mom.
Right.
What was different? What was the reason that this time when you came to hospital, you ended up going home on opioid agonist therapy as opposed to going back to the downtown east side?
I felt in some sense that it was my only option, to be honest with you.
Okay.
I really did.
Practically speaking.
Because? Yeah, because of my leg.
Okay.
Because of my injury.
Okay. Okay.
And rehabilitation-wise, I've broken bones in the past. Never my leg. I've had surgery on my leg in the past.
Mm-hmm.
Not addiction-related, athletics-related, but
yeah.
I know what the rehabilitation process entails.
Yeah.
So, just facing my harsh reality at this point, I realized that the only way for me to not endure infections and for this injury to actually heal, I have to go home.
Were you done using at that point?
No.
Okay.
Looking back on it, no, I wasn't.
Okay. How come?
I think I went home as necessity speaking, like,
okay.
You know what I mean?
Mm-hmm. Mm-hmm. But I take it at this point you were able to do that because at least you didn't have that.
I didn't have
immediate drive.
That immediate withdrawal, the pain.
Okay.
All that other stuff that factors into a decision whenever you're living in addiction.
Yeah.
Suboxone has now taken care of that, taken on that load.
And this is very interesting for me because it's, in many ways, it speaks to some of the what might be at the core of many people's addiction, because you're describing a scenario where we've addressed the physical drive to use, we've addressed the cravings, we've addressed the withdrawal, right? We've addressed the physical pain, but yet you're still not, and you've described this horrible circumstance that you came from, but you're still not done.
Not yet.
How come?
The way that I felt, for my own personal experience, I felt like it was out of my control.
Okay.
Like that decision to go back.
Yeah.
Because as you know, as soon as my leg was healed and I was able to put pressure, like body weight on my leg,
Yeah.
no longer needed crutches and so on and so forth, I left my mom's house.
Right. Okay. Yeah. And let's paint that picture, because you left VGH.
Yes.
You went back home with your mom.
Yeah.
You had a number of, I can't remember how many weeks you had not using. What was that? Was it?
I think it was 6 weeks.
6 weeks.
Or something
so
like
6
that.
weeks not using.
Yeah.
6 weeks.
Enough time to experience what life's like not using.
Right. So you're no longer living without a home. You're no longer on the streets. You're no longer doing crime to get money, to get this.
No.
But yet you're in the back of your mind, you're thinking about going back.
Yeah. And I guess what it possibly could have been, it's hard to put like a single thing on it, but because for me and my story, I've been using for a long period of time, and whenever everyone has their own sort of problem solving skills or routines or things that they normally do whenever they come into a problem. Some people get really mad, some people go for a walk, some people don't talk to you for a week, whatever. Everyone has their own thing. And for people in addictions, the substance, the high, is their problem solving thing. Coping mechanism. So when I first came home, I experienced, the 6 or whatever weeks it was of not using, loving family, healthy food, sleeping in my own bed, my own room, loving life for the most part. And what caused me to leave was, looking back on it, the most silly of instances, because it's happened multiple times, multiple different occasions in my clean time this time. And it hasn't fazed me, it hasn't affected me the same way. But previously it was awkward tension with my family members in my household, where it was awkward between majority of the household. People weren't really socializing or interacting the normal way that they do, experiencing some sort of resentment for each other or whatever it may have been. And I felt that, I took that on, and I felt uncomfortable. I wasn't enjoying myself in the house anymore. It was awkward in the house. I was like, you know what? I want to feel good. I want this problem that I'm feeling, this uncomfortable feeling, to be solved.
You wanted to extinguish those negative emotions.
Exactly. And the only way I knew how to do that was get high.
Yeah.
So literally, I called a taxi, and I paid $100 for a taxi to take me from my mom's house in Langley to the downtown east side. We got high. And I stayed down there for months.
Yeah. So
until I left.
Right back into the cycle.
Clean. Yeah, right back. Like I never left.
And then what happened? How did you end up leaving again?
How did I end up leaving again was, this time when I went back, for some reason, I was experiencing overdoses a lot easier than I was previous. Maybe that was the time I had clean, maybe it was the substances that were circulating downtown, I don't know. But I was overdosing a lot easier than what I remember from before. And so there was multiple different occasions where I was ending up in hospital. I would be revived with Narcan, brought into the hospital via ambulance, and then taken care of for a bit overnight, let out.
Yeah.
And that happened on multiple different occasions. And then it happened once when I was out of town committing crime to try to find ways and means to get more substances in Richmond.
Mm-hmm.
And I ended up in emergency in Richmond, and I don't remember a single thing from when I was using that night. I don't remember a single thing committing crime that night. The only thing I can recall from that night is waking up in the hospital bed, confused out of my mind, not knowing where I am, because I know what the hospitals around town look like, feel
right.
like, sound like. I don't know where I am. I know I'm not somewhere where I'm used to being, and the first person I see is my mom. And there was something about the continual overdoses, and then it happening once. I get taken out of the norm place that I'm used to, that I know I can just exit the hospital, pick up, get high, problem solved. I was now somewhere foreign where I don't know people. I can't pick up there. I don't know the system of the street there. You know what I mean?
Mm-hmm.
And the first person I see is my mom, and she's not mad, you know?
Mm-hmm.
She's not upset.
Mm-hmm.
Yeah. And she welcomed me back home with open arms, and normally prior to me coming home I have to detox, either at Directions Youth Detox, hospital, somewhere controlled environment where she knows I'm clean for X amount of time that I've been there. This time was different. She was more open-minded. She was willing to work where she didn't really set any boundaries for me at that point. And by that I mean, she wasn't like, okay, you want to go to detox? Do you want to go to the hospital? Do you want to stay in the hospital? Like, what do you want to do? She was like, she asked me what I wanted to do, and I was like, I don't know. And she's like, well, like, do you want to get some sleep? Multiple times my mom has rented a hotel for a night so I can get some rest, somewhere safe. She was like, do you want to get some rest? And I was like, yeah, I was tired. And she's like, why don't you just come home? So yeah, I came home with her that night, and had a rough sleep, withdrawing in my bed. I've withdrawed before many times, right? And then I think she frantically called you, trying to seek support for getting a prescription for Suboxone, because it's worked in the past.
Yep.
I've been to treatment multiple times, and the first time I experienced success with Suboxone was in treatment. I had 11 months clean. Mm-hmm. She knew that worked, and I was game for it. I wanted to get on Suboxone. I wanted the withdrawals to stop, and I believe she called you not too long after that, and I had to be careful. I remember I had to be careful because you have to wait a certain amount of time from when you stop using to when you start Suboxone, so you don't get the precipitated withdrawal.
We did a home induction.
So you facilitated that for me. Yeah.
Right. Yeah, your mom called.
Which was game changing.
Yeah. Your mom called, and we did it. So I called in the prescription, and she managed you at home,
and she's been doing it ever since.
How long ago was that?
I've been clean since October 1st last year. Yeah. Thank you. And when I overdosed in Richmond and you came to see me in the hospital, I don't know what changed for you, but that standard or that thing that you set for yourself was you just wanted to try something else, and Yeah, it meant the world to me that you're open to explore other options.
We did try the detox at first, and it wasn't an opportunity. And then it was, okay, we
But in
haven't
the
tried
past,
this.
it would have been
100%, because that's what we were taught as parents through our groups, right?
Yeah.
Setting boundaries, and this is what you have to do. You have to let them hit rock bottom. And then the downtown east side taught me, no, you have to show compassion, and you have to open up. You have to have certain boundaries that you believe in, and there's the one boundary that I have.
Yeah.
But yeah, that day it was, okay, do you want to give this a try? Okay, it's going to be hard. Right?
Yeah, for sure.
Yeah. And it was the birds outside, laying on the couch while we waited the 15 minutes till we could call back Dr. Sawyer.
Yeah.
Can we call him back? Is it 15 minutes yet? Hugging each other really tight.
Yeah.
I'm not going to say any bad words, but we kept on repeating the tell it to F off.
Yeah.
Don't let it win. Tell it to F off. You're going to get it this time. Yeah. So glad we tried something different.
Yeah,
it's not
me too.
always they put it in a box and they tell you this is how you do it. It's not how it works.
Ideally, the detox is the safe way to go.
Yes.
Most definitely.
Yes.
But at the end of the day, you got to find out what works
For you and your family.
for you and your family, and for it to work on something that's not highly recommended or isn't the safest way to go about it is pretty awesome, I think, for you to be open-minded to that.
Thank you. I'm proud of every minute of every day. Because it just takes that one second for you to switch. And every minute, it's 100% your choice. And I'm so proud of the choices that you continuously make every day. I know not every day is an easy day.
Yeah.
But you take a step and you work through it, or you try something different, or you do something different, and you get through it. And I'm so proud of you.
Thank you.
I'm so excited to see what your next steps are going to be, where you're going to end up.
Thank you. Means the world coming from you.
Absolutely, babe. My baby's home.